Morning, everyone. I am Dr. Hardik Kotecha. I am a gastroenterologist working at Zydus Hospital, Ahmedabad. Today, I'll be talking on inflammatory bowel disease. On 19th May every year, World IBD Day is celebrated, and it is been celebrated to create awareness about inflammatory bowel disease, in short, IBD. Now, actually, what happens in IBD is that there is an inflammatory process going on in the lining of the digestive system. Broadly, we divide IBD into two forms: ulcerative colitis, where predominantly the involvement is of the colon, which means the large intestine, and Crohn's disease, where the inflammatory process may extend anywhere from the mouth to the anal canal. However, predominantly in patients with Crohn's disease, the distal small intestine and the proximal large intestine are involved. Now, why is it important to talk about inflammatory bowel disease? If we see the burden of disease after United States of America, India is the second largest country with highest burden of inflammatory bowel disease patients. Around 14 lakh patients in India are suffering from IBD. Also, because it is a chronic process, chronic and relapsing process, whereby the medicines which are available can control the disease. It cannot be treated or cured. Like patients who are suffering from hypertension or diabetes, where the patient has to take tablets for diabetes or blood pressure for a long period of time, practically lifelong. Similarly, in inflammatory bowel disease, the patients are supposed to take treatment lifelong. Now, as we are not having a cure for the disease, and the symptoms are many times very frustrating, so these patients require a lot of social support for their working in their routine daily activities. So it is important for everyone to know about inflammatory bowel disease. Now, as the treatment is lifelong, if we are able to detect the disease early and start the treatment at the right point of time, probably we will be able to prevent the serious complications which can happen if the disease is not detected in time. If we see the Western literature, even in United States or even in the Europe, where the medical care is very well developed, the mean time of delay from the onset of disease to the diagnosis ranges from around 9 months to 1 year. So it is very, very important that we identify patients early and treat them so that they don't develop complications. Though the disease is not lethal, so death occurring from inflammatory bowel disease is very rare. It definitely jeopardizes the patient's life a lot. So it is important to be aware of the disease. Now, predominantly, the disease affects individuals between the age of 20 to 40 years. So they are in the prime of their life. However, children as young as 5 years and elderly people as old as 70 or 75-year-old may be suffering from IBD and diagnosed for the first time. So if we look into the etiology, why does this disease happen? It can be divided into many subgroups. There is a strong genetic background, and many genes are identified which can lead to development of IBD. There is a familial predisposition. So 1 in 5 patients of IBD will be having one family member affected by the disease. Monozygotic twins will have higher preponderance for the disease, especially for Crohn's disease compared to ulcerative colitis. Also, there are a lot of environmental factors like breastfeeding protects from IBD. There is a hygiene hypothesis whereby it has been thought that people who are from higher socio-economic class and those who are living more affluent life, drinking purified water and hygienic food, they are more prone to develop this disease compared to people like farmers and laborers who are exposed more to environmental antigens. There are multiple infections which have been thought to be responsible for IBD, and IBD is considered to be a disease caused by immune dysregulation. We have all got immunity, and immunity protects us from various infections. But when the immune cells, they become activated from a stimulus which is not supposed to be very harmful, and they start damaging our own body cells, it leads to autoimmunity or immune dysregulation, whereby our body will be damaged by our own immune cells, and this is what happens in inflammatory bowel disease. Our gut microbiome, we have got a lot of bacteria in our large intestine and small intestine. The colony counts are as high as 10 raised to 12 per cubic mm. So these bacteria are very important for our healthy life and maintaining the normal lining of our digestive system. So if there is any insult which triggers a change in the microbiome, that can also trigger IBD. So many drugs, antibiotics, non-steroidal anti-inflammatory drugs have been implicated to trigger inflammatory bowel disease. Also, there are certain foods which are responsible for triggering inflammatory bowel disease. Now, what will happen to a person when he is suffering from IBD? If we talk about ulcerative colitis, predominantly it involves the large intestine, and the patient, when having a distal colonic involvement, predominantly involvement of the rectum and the sigmoid colon, will present with episodes of diarrhea, where the amount of stool passed during each episode will be not very high. It will be associated with passage of some mucus and blood in stools, and there will be tenesmus and urgency. So the patient will, once the patient gets the urge to pass stool, he will not be able to hold the stool. He will have to rush to the toilet. Also, he will have some pain in the area after passing stool. If the disease is more severe and involving almost the entire colon or half of the colon, patients will have more severe diarrhea. There can be significant blood loss. Patients may have abdominal pain, fever, weight loss, and all these complications. If the disease becomes very severe, the entire colon may be dilated, where it is labeled as toxic megacolon, which may merit an urgent surgical intervention. In Crohn's disease, when it is predominantly involving the small intestine and the large intestine, the distal small intestine, patients will have pain in the tummy, which may be colicky type of pain, where the pain will come in waves. It will go up, stay there for 10 minutes, 15 minutes and go away, or it may be a continuous type of pain. Associated with it, patient will have diarrhea. It may be watery diarrhea or diarrhea with contains blood. There will be vomiting, loss of appetite, weight loss, there may be fever. If the disease is advanced, it can get complicated by formation of abscesses in the abdomen, because the Crohn's disease, the entire thickness of the bowel is involved, and there will be collection of pus pockets inside the abdomen. If there are development of fistulas, which are abnormal tracts which can connect one part of the small intestine or large intestine to other part of the intestine or to other organs like the urinary bladder, the uterus, then patient will develop fistulas. Very large amount of patients, around 17% of patients with Crohn's disease will have perianal disease, where there will be fissures, perianal fistulas and perianal abscesses, which are many times difficult to treat. Also, patients who have long-standing IBD, especially ulcerative colitis, they are at risk of development of malignancies in form of carcinoma colon. So whenever a person is having such symptoms, and especially if the symptoms are lasting for more than 1 month or 2 months or 3 months, they should consult a doctor, a specialist who can help in diagnosis of the disease. Now, once inflammatory bowel disease is suspected, if we go to a doctor, what will be the doctor doing? He will do certain blood test, some form of imaging, which may include an ultrasound, a CT scan or an MRI of the abdomen, and a colonoscopy will be required. Sometimes an upper GI endoscopy is also required, whereby we can see the involved bowel segments, we can see the ulcers, we can take samples from the involved area, get them to the laboratory, do a proper pathological examination and confirm the diagnosis of inflammatory bowel disease. There are many other diseases which can present like this, which may have ulcers in the intestine, but their treatment may be different. So it is very, very important for us to reach a diagnosis that this patient has confirmed inflammatory bowel disease to treat them properly. Now, treatment of these disease, because it is a not curative disease, we have to treat the patient for long, and many times if complications happen, patients require surgical intervention whereby a segment of the large intestine or small intestine is removed. In ulcerative colitis, we have to remove the entire large intestine. So treatment consists of various drugs, and depending on the severity of the disease, we will have to make judgment about using which drugs are required. Some of the drugs do have significant side effects and they are costly also. Nowadays, at least in India, we have all the medicines which are used in the Western world for the treatment of this disease. And compared to the Western world, the cost of the medicine is also cheaper. They do have significant side effects. The patient will require close clinical follow-up, tests, and titration of the medicine as per the response. I would conclude my talk after this. Thank you.